Hey there, are you worried that your child has the diarrhea? Is your child pooping more frequently? Well, what to do? Is it safe to give over the counter medicines for your child with the diarrhea? What to do when you're traveling and your child has the diarrhea? Well, before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you, moms and dads, so you can raise happy and healthy kids. In today's Ask Me Anything episode, I will answer your 10 most common questions about childhood diarrhea. So let's get right to it. First question: what causes diarrhea in children? Diarrhea can be from several factors, and the most commonly is due to the infection. It can be from a bacterial infection, viral infection, or from parasites as well. Other causes of diarrhea can be from allergies. It can also be a side effect from certain medications, or if your child has a certain medical condition where diarrhea is one of the symptoms. Number two, how can I tell if my child has the diarrhea? So, diarrhea is basically characterized by frequent stooling, um, and if there are watery stools. So, if your child is pooping more frequently than usual, and if the consistency is watery or liquidy, then most likely your child has the diarrhea. When should I call the doctor about my child's diarrhea? So you should let your doctor know if your child's diarrhea has become severe or there are other symptoms such as vomiting as well. So if your child has frequent loose stooling, which can be accompanied by vomiting, and now if your child is showing signs of dehydration, where your child is weak looking, um, where your child has fewer wet diapers, your child has sunken eyes, those are the signs that your child might be dehydrated. Also, you need to worry and to let your doctor know if you note blood or mucus in your child's stool. If your child has high fever with the diarrhea, or if your child's diarrhea has been persisting for a couple of days. All right, how can I treat my child's diarrhea at home? Yes, you can treat your child's diarrhea at home by keeping your child hydrated, giving plenty of liquids, water, most importantly, give electrolyte solution, and to continue on feeding your child. So it can be breast milk or formula. Number five, should I stop feeding my child if they have the diarrhea? No, it is recommended that you continue on feeding your child. You can give small, more frequent meals instead. And how about try to avoid spicy foods, fatty foods, and dairy until your child's diarrhea has recovered, because these kinds of foods might make your child's diarrhea worse. Can I give my child over-the-counter diarrhea medication? No, over-the-counter diarrhea medication, especially those that um, lessens or stops the baby's pooping, is generally not safe for kids. So it is important that you ask your doctor first about it and seek consult. Also, the over-the-counter diarrheal medication can make your child's diarrhea worse or can worsen the symptoms or might have some side effects to your child. So how can I prevent my child from getting diarrhea? So diarrhea, if it is caused by an infection, it can be prevented by good hand hygiene. So frequent hand washing is recommended to prevent the diarrhea. And also, vaccination is available. Your baby can be given a rotavirus vaccine, which prevents rotavirus infection that causes acute gastroenteritis in babies. Um, and it is the most common cause of diarrhea in infants and young children. Is diarrhea contagious? The next question. Yes, diarrhea can be contagious if it is brought about by a viral or bacterial infection, which is why, again, it is important that good hand hygiene is practiced and to avoid close contact with individuals, with other persons who have the diarrhea. What should I do if my child has diarrhea while traveling? So, while traveling, make sure your kids are practicing good hand hygiene, washing their hands often, and if your child gets the diarrhea, it is important that you keep your child hydrated by giving plenty of fluids and electrolyte containing solutions. How about when packing for traveling, you pack oral rehydration solutions and also familiar foods that your child likes. And then number 10, when can my child return to school or daycare after having diarrhea? Well, your child can return to school or daycare if after 24 hours they are diarrhea free and no other symptoms such as no more vomiting and no fever. Hey, if you like this video, watch my next video where I teach you about other child health problems.